Hello viewers, myself Dr. Pawan Kumar Reddy, Research Scholar, Department of Pharmacology, Sri Siddhartha Medical College, Tumkuru. In today's session, we are going to discuss about diuretics. What are these diuretics? Diuretics are the agents or drugs which increases the net output of sodium and water in the urine. Okay, we will discuss this in upcoming slides. First, we will go through the introduction. First, these diuretics, they mainly act on kidneys. Kidneys is a major regulatory organ, and it is made up of functional unit called as nephrons. And each kidney consists of more than 1 million nephrons. Okay, this kidney has mainly three functions. First function is regulatory action. It helps in maintaining acid, base, fluid, and electrolyte balance. Next one is excretory. It helps in excretion of nitrogenous waste products from the body. And last one is hormonal. It helps in activation of vitamin D, production of renin and erythropoietin. Next, we will discuss about the mechanism of urine formation. Urine formation mainly consists of three steps. It consists of glomerular filtration, tubular reabsorption and active tubular secretion. About nearly 180 liters per day fluid is filtered from our kidney. In this, only 1 to 1.5 liters of urine excreted in the form of urine. In this, 99% of the remaining is reabsorbed back by our renal tubules. And next we will discuss about the classification. What are the different classes of the drugs we are going to use? Coming to the classification of diuretics, based on efficacy, these diuretics are divided into three different classes. First class is ice sealing diuretics. Second class is medium efficacy diuretics. And third class is weak diuretics. Okay, based on their efficacy, these are divided into three types. We will see examples of this one by one. First, we will see examples for ice sealing diuretics. Examples are furosemide and torsemide. Next one is medium sealing diuretics, or medium efficacy diuretics. It is divided into two different subclassifications here. One is benzothiazidines. Example is hydrochlorothiazide, benzthiazide. Next one is thiazide-like diuretics. Examples are chlorthalidone, exipamide, indapamide and clopamide. And third classification is weak diuretics. Here it is sub-classified into three different classifications. First one is carbonic anhydrase inhibitors. Example is acetazolamide. Next one is osmotic diuretics. Examples are mannitol, isosorbide and glycerol. And last sub-classification is potassium sparing diuretics. Again, it is divided into two sub-classifications. One is aldosterone antagonists and next one is renal epithelial sodium channel inhibitors. Examples for aldosterone antagonist is spironolactone, and for renal epithelial sodium channel blockers is miloride. Next, we are going to discuss about site of action, where this diuretics going to act. This diuretics going to act mainly on nephrons. Here you can see in nephron, carbonic anhydrase inhibitors, they mainly act on proximal convoluted tubules, whereas loop diuretics, they are going to act on thick ascending loop of Henle, and thiazide diuretics, they mainly act on early distal convoluted tubules, and potassium sparing diuretics, they mainly act on site 4, that is collecting ducts. This is the major site of action where our most of the drugs going to act here. And apart from this, another one class of drug is Misidia, that is osmotic diuretics. The osmotic diuretics mainly acts on proximal convoluted tubules and descending loop of Henle. Okay. Next, we will moving into the classification of diuretics by their site of action in the nephron. First one is proximal convoluted tubules. What are the drugs that are going to act on this proximal convoluted tubules, PCT? This is called site 1. Okay, drugs class like carbonic anhydrase inhibitors mainly going to act here. Example is acetazolamide. Next one is thick ascending limb of loop of Henle. This is site 2. Mainly our loop diuretics going to act here. Examples are furosemide, torsemide. And third classification, that is early distal convoluted tubules, that is site 3. our thiazide diuretics mainly going to act here. And fourth one, that is late distilled tubule and collecting drugs. Drugs like aldosterone antagonists, especially spironolactone and miloride, going to act here. And last class, that is drugs acting on entire nephrons. These especially osmotic diuretics, they mainly act on site proximal convoluted tubules and loop of Henle. Examples are mannitol, glycerol, isosorbide. Next, we will discuss one by one class with their mechanism of action, adverse effects, and their indications. First, carbonic anhydrase inhibitors. Example is acetazolamide. Its main mechanism of action, it mainly inhibits the carbonic anhydrase enzyme in the proximal convoluted tubules at site 1. Okay, site 1, it is called a proximal convoluted tubules, and it also acts on collecting ducts. What this acetazolamide will do? This acetazolamide decreases the formation of hydrogen ions, which causes decrease in sodium and hydrogen exchange, and which also results in the decreased reabsorption of bicarbonates, which results in more bicarbonates and sodium lost in the urine. Apart from this, in distal convoluted tubules, due to presence of high sodium, there will be a more exchange of sodium and potassium. This potassium gets into the lumen and potassium also get lost here. Okay, what are the results of this mechanism of action? This results in the formation of alkaline urine and loss of sodium, potassium and bicarbonates. Where we going to use this acetazolamide? We mainly use this drug in the treatment of glaucoma because it decreases the intra-optical pressure. Next one is, it is also used as an urine alkalizer. It helps in the treatment of acidic drug poisoning. And last one is, it is used in treatment of acute mountain sickness. It is used as a prophylactic drug, and it is also used for the relief of mountain sickness. Coming to adverse effect, due to excess loss of potassium, it causes hypokalemia, and it also results in metabolic acidosis, and it results in the formation of renal stones, hypersensitivity reactions, drowsiness and headache. Contraindications. These carbonic anhydrase inhibitors, especially acetazolamide, is contraindicated in case of liver disease, especially in cirrhosis patients, and COPD, chronic obstructive pulmonary disease. Next class of drugs, that is osmotic diuretics. Example, mannitol, glycerol and isosorbate. What is the mechanism of action of this osmotic diuretics? These osmotic diuretics, they mainly increases the plasma osmolarity, which increases the plasma concentration. Due to increase in plasma concentration, there is a shift of fluid from extracellular content to intracellular fluid. Sorry, extracellular compartment to intracellular fluids. With this, there will be an increase in extracellular fluid volume, and which results in the increase in GFR rate. Due to increase in this GFR rate, it is more fluids get freely filtered at glomerulus, and increase in tubular fluid osmolarity, which causes increase in osmotic pressure and prevents water and sodium chloride reabsorption. Next, where is the site where this osmotic diuretic is going to mainly act? They mainly act on proximal convoluted tubule, as we already discussed in our early slide. It mainly acts on proximal convoluted tubule and loop of Henle. What are the effects of these osmotic diuretics? It results in the increased urine output or increase in urine volume, and it also causes increased excretion of sodium, potassium, calcium, magnesium, chloride, bicarbonates and phosphates. Next, uses of this osmotic diuretics. Where we are going to use this osmotic diuretics? These osmotic diuretics are mainly used to decrease the intracranial pressure or tension, which is mainly helpful in cases like stroke. And next one is, it also helpful in reducing intraocular pressure, and Apart from this, it is used in during surgery times and transfusion, any reactions related to transfusions. In those conditions, it prevents the acute renal shutdown, and it also maintains the extracellular fluid osmolarity during the procedure of dialysis. Coming to adverse effects, when these osmotic diuretics, especially mannitol, is given rapidly through IV route, it can cause pulmonary edema. And apart from this, when glycerol is given, it causes hyperglycemia. And apart from these adverse drug reactions, this drug causes nausea, vomiting, and headache. Coming to contraindications of these osmotic diuretics, it is contraindicated in case of congestive cardiac failure, pulmonary edema, chronic edema, anuric renal diseases, active intracranial bleeding, and active tubular necrosis. Next class of drugs, that is loop diuretics. Loop diuretics are also called as eye-sealing diuretics or eye efficacy diuretics. Examples are furosemide, torsemide. Mechanism of action, they mainly act on thick ascending loop of aniline. They mainly inhibits sodium, potassium and 2-chloride co-transporter. With the inhibition of this co-transporter, there will be a more excretion of sodium, chloride, bicarbonates, calcium and magnesium. Due to presence of more sodium in the fluid at the distal convoluted tubule, it also results in again there will be an exchange of sodium and potassium, and more amount of potassium is lost. Next, coming to therapeutic uses. Therapeutic uses, it is mainly used in treatment of edema, hypercalcemia, acute pulmonary edema, cerebral edema, hypertension with renal failure, and volume overload during blood transfusion. Coming to adverse effects, these loop diuretics can cause mainly electrolyte imbalance. It can cause hypercalcemia, hypernatremia, hypercalcemia, and hypomagnesemia. Coming to its metabolic effects, it can cause hyperglycemia, hyperuricemia, which results in the gout, and hyperlipidemia. And apart from this, it can cause ototoxicity, which is a reversible condition. Patient may feel with tinnitus and short-term loss of hearing. And this is mainly seen in patients with who are on aminoglycosides. Next one is it also causes sensitivity reactions in some patients, especially rash and photosensitivity reactions. Next class of drugs, that is thiazide diuretics. Examples are hydrochlorothiazide, chlorothiazide, chlorthalidone, indapamide, exipamide. Mechanism of action, they mainly act on early distal tubules. They mainly inhibit the sodium chloride symporter, which leads to increase in sodium and calcium excretion, and this presence of more sodium in the which results in the presence of more sodium in the fluid at the distal convoluted tubules, which causes increased sodium and potassium exchange, and it also results in loss of potassium. And in this process, mild quantity of bicarbonates also lost, and it also in this there will be a decreased excretion of calcium. More amount of calcium is reabsorbed. Coming to adverse effects, it can cause electrolyte imbalance like hypokalemia, hyponatremia, hypomagnesemia, and hypercalcemia. Coming to metabolic effects, it can cause hyperglycemia, hyperuricemia, and which results in gout, and hyperlipidemia. And some other important adverse effect of this drug, in male it can cause impotency or erectile dysfunction, and it also causes rash, photosensitivity reaction, GI upset. And this class of drugs are contraindicated in case of pregnancy, because they can decrease the placental perfusion, which can causes risk to fetus. Next class of drugs, that is potassium sparing diuretics. This potassium sparing diuretics are subdivided into two classes, that is aldosterone antagonists, and next one is direct acting potassium sparing diuretics. First we will see aldosterone antagonist. Examples are spironolactone. Mechanism of action, they mainly act on late distal tubules and collecting duct, and they mainly blocks the mineralocorticoid receptors, which helps in decreasing in aldosterone induced proteins, which causes sodium excretion and retention of potassium, and also causes increased excretion of calcium. All other classes of drugs can cause loss of potassium, but in case of potassium sparing diuretics, here there will be no loss of potassium. Here more amount of potassium is reabsorbed back in our body. Coming to uses, where we are going to use this potassium sparing diuretics? We mainly use in the treatment of edema, and in case of chronic heart failure, and in case of treatment of hypertension, we mainly add this potassium sparing diuretics along with loop diuretics, along with loop diuretics or thiazide diuretics, to balance the lost potassium in our body. And apart from this, it is also used in case of primary hyperaldosteronism. Coming to adverse effects of these potassium sparing diuretics, especially aldosterone antagonists, it may cause hypercalcemia. It may, due to excess absorption of potassium, there will be a increased risk of hypercalcemia, and it can cause drowsiness, confusion. And apart from this, few major adverse effects here is, in males it can cause gynecomastia, in females it can cause menstrual disturbances and loss in decreased libido. And coming to last subclassification of drug, that is direct acting potassium sparing diuretics. Examples are miloride. They mainly blocks the epithelial sodium channels that present in our late distal convoluted tubules and collecting duct, which can cause increase in sodium excretion and helps in retaining potassium. And this drug is used alone with, same as like aldosterone antagonist, this drugs also used along with loop diuretics or thiazide to prevent the hypokalemia. Thanking you.